Hi, I'm Sue Rabati. I started Medchetta Foundation to change the conversation between doctors and patients about the side effects and the long-term effects of the medicines we all take. Today we're meeting with Dr. Candida Fink, who is a leading expert in bipolar disorder. She's the author of The Ups and Downs of Raising a Bipolar Child with Judith Lederman and Bipolar Disorder for Dummies with Joe Kranick. You're treating somebody for depression, probably a woman, the majority of women, weight gain. Would that make it more difficult to treat her for depression? And then, with the risk of diabetes, is Abilify worth the risk of that?
It's a very good question, and that, of course, is the question always. When you go to prescribe a medication, when are the risks of not using the medication potentially beginning to equal the potential risks of medicating? Now, the risks of untreated depression or incompletely treated depression are significant. In the worst case scenario, of course, it can be lethal. People can die from suicide. They can also die from not taking care of themselves as well, from many things. It can also, of course, create great morbidity, if not mortality, where there is just such a decline in quality of life and function. So there are great costs to inadequately treated depression. That does not in any way minimize the costs of weight gain and certainly medical risks such as type 2 diabetes. So that's a very important, it has to be a lengthy, very honest conversation between patient and doctor, and it has to be an ongoing conversation that has to be always addressed at every visit if you do make the decision that you're following that and thinking carefully about ways to minimize side effects and measuring the benefit versus the adverse effects.
You mentioned an ongoing conversation. Is Abilify and antidepressants, is that enough of a treatment, or do you need to be in therapy at the same time?
Treating depression should never be just medication. It's always a comprehensive approach that is critical. So psychotherapy is a mainstay, very important. Cognitive behavioral therapy is a subtype of therapy that has very good research on effectiveness in treating depression. But certainly supportive care, work with the family is also very important. Things like exercise, and there have been a number of studies suggesting that adding exercise, just like you might add Abilify, can be extremely helpful. So now that's a hard thing. When you're depressed, it's very hard to get going, to get moving. It's the catch-22. You don't want to move, but moving will make you feel better. But if you can work together, work in the psychotherapy, in the support, those kinds of things are extremely valuable and helpful.
For those patients for whom Abilify is the best choice, are there ways to minimize or even avoid some of the side effects?
Well, interestingly, exercise once again comes back as a headline there, because it's one of the ways that we know we can help to limit weight gain. Again, not so easy to do. It's very easy to say, oh, go exercise, but it's not so easy to do, especially when you're not feeling well. But it can be very preventive. Certainly, we talk about diet as well. Again, not so easy. Careful monitoring. When you come to the doctor, there are protocols for how often we're going to check lab tests, blood tests for your glucose levels, your blood sugar levels, your insulin levels. So we want to make sure we're following that carefully so we can take action or intervene sooner rather than later.
Doctors have the ability to prescribe a drug for any issue that they feel is appropriate. Are you hearing of Abilify being prescribed for off-label uses?
You know, a lot of psychiatric medications are used off-label, especially in the world of child and adolescent, because the research and the FDA indications are much more limited. But probably the most common off-label use that I hear about is for agitation. So rather than specifically irritability in a child with autism, it might be a child with very bad ADHD or an adult with a complicated depression, anxiety story that is very easily agitated. So it's also used for the agitation of dementia in elderly. I don't treat geriatric patients, so I'm not familiar with that, but I do know it's a very high risk. And so there's a lot of debate about that use, because it's very effective, I think, for reducing agitation, but it carries some serious medical risks in the elderly.
Thank you. Those were some great answers. I really appreciate it. Please visit Dr. Fink's website at finkshrink.org and read her blog, Bipolar Beat, at psychcentral.com. And please visit medshadow.org. Thanks for watching today. See our other videos on YouTube and visit our website at medshadow.org.